All right, Ali, listen, I wanted you to come here to talk about this sort of new concept that
Absolutely.
I'm really, really new to, and this idea of pain and the contribution that dentists actually have for pain. So let me kind of do the background of my knowledge,
Yeah.
and then I'm going to kind of chime in and hear your thoughts, right? So, 2021 was when I discovered that at Mayo Clinic, there's a whole pain department, and the head of the pain department is a dentist. And I didn't get it. I was like, I don't understand. Like, this is Mayo Clinic. What's going on there, right? And then, then I found out that there's a huge contribution to bite and total body pain. And in fact, dental splints and devices have been used actually for a really long time to improve pain, not just improve pain in the head and neck, but really the whole body. And I think it's making a comeback. And so from that time on, I started working with, like, I started consulting for some device companies, medical device companies, interventional pain.
Yeah.
Um, and they had a team of dentists as well. And I was like, wow, I guess it's a thing, but it's not something I really learn in medical school. I just kind of learned to, prescribe some medicines or acid physical therapy or chiropractic or acupuncture and, deal with that. But then there's a huge oral contribution to pain.
Yeah.
So let's talk about that.
Absolutely.
Yeah. Give me a bit of an introduction of what that's like, and then and also we'll have you introduce you as well.
Absolutely.
Yeah.
Um, you know, and me and you have seen this, and it's one of those things where in the beginning I kind of organically got here, and we'll talk about that in a minute, but me and you have seen it many, many times that the alignment kind of starts up here. And if you're misaligned here, then your body does different compensations. And those compensations work their way down the body, just depending on how far misaligned you are. And I think what the best way I could put it is we all have a different adaptive range, and that adaptive range can change with life circumstances. So if you have a lot of external pressures, your adaptive range, I think, narrows.
What do you mean by adaptive range?
Hey, let's do an example.
Okay.
So you are on one of the best dream vacations you've ever had with your whole family. It's something you've been dreaming about for years. You're in beautiful weather. Everything is perfect. You're eating clean, healthy food. And you kind of stumble and twist your ankle. And, but your mind is in such a good place that the pain just kind of fast dissipates fast and you're just able to continue to enjoy that vacation.
Yeah. That's like the endorphins coming in, right?
Yeah.
So the adaptive range, then I guess, is your range of adaptability to the situation.
Yeah. It's
Which,
like the context of the situation,
yeah.
right?
And so I like my vacation, right?
Yeah.
And therefore, my perception of pain or my is less, and endorphins are high, right?
Yeah.
Yeah.
And
Well, how does that relate to the mouth?
so I think and I believe that basically that small, and we're going to call it small misalignment, can kind of propagate into something much bigger.
Okay.
And it's like this chronic low grade trauma that builds up in the body.
Oh, interesting. So when we say alignment, it's about the teeth aligning together.
Yes.
Interesting. So, because a lot of people with pain issues, especially addressing the fibromyalgia population, TMJ, even peripheral neuropathy, um, we always see that there's some oral contribution to their pain, even if they didn't know it. Even though the dentist don't necessarily tell them or aware, right? And I'm not sure this is in dental training either. Is it?
It's not. It's not. And
No.
that's what I was kind of going to get to. And I said,
Yeah.
oh, I'm going to get to that. And I think now is a good segue to talk about that, but I'll let you finish your thought.
So my thought is this. Last year we did the fibromyalgia summit, and we had some where multiple dentists actually speak about how even like 1 or 2 millimeters off of alignment of the teeth, left, right, front, and back, can actually produce some significant and neurological input to the brain. The brain will perceive that as discomfort. As you were just saying now, like they become little traumas, like micro traumas, right, to the body, because the alignment. And I also learned that one of the people presenting was a chiropractor, and he said, yeah, when your teeth are off, your spine is off, your TMJ is off, even just a little, just a hair. But over a number of years, decades sometimes for people, that turns into this perception of perpetual discomfort. And that turns into the body creating compensation mechanisms in the fascia, which is the connective tissue of the body. And because there's millions and millions and millions of nerve endings in the fascia makes it hurt. If the contraction or the constriction is too tight, then people are having jaw pain, TMJ issues, migraines, temporal headaches, occipital headaches, which is in the back, neck strain, people holding the shoulders up here, right? And I'm sure people listening to this, oh, that's me. That's a lot of people. And perhaps their hips might be an issue here. Their SI joint might be an issue. Their knees might be an issue. Their ankles an issue. Their feet might be an issue. And that creates what is total body discomfort. So that was really the first time where I kind of heard it like this. And as I talked to more healthcare professionals, I realized, my gosh, pain is complex.
Very.
And a lot of people have been through chiropractic. They've been through acupuncture. They've been through even spinal stimulation devices and implants, right? And and then they're on pain medications. Some people are pain pumps. But no one's talking about this oral contribution to pain, like in the teeth.
Unfortunate.
Unfortunately, well, I would, but I didn't know about it before.
We all learn. The journey.
We're all learning. So, I certainly didn't learn at school. But tell me, this is a great segue to talk about like dental training for you. Where was the like how were you trained conventionally, and how did you get to this part where you're dealing with people with pain?
So we all start somewhere, and dental school is obviously, the beginning of it. And you're taught some parts about the human body, but mostly you're taught tooth mechanics, which, is a starting point, and you have to start somewhere. And then as you start developing, like, okay, I understand the tooth part, then you really start looking, especially, I think the biggest turning point for me was when I went from looking at single teeth to redoing a whole mouth, like someone who's destroyed their whole mouth and now they want a new smile. And I learned how to build that beautiful smile and give the person what they want. But what really bothered me about that is, how did we get here? Some of these people have good oral habits, like they brush, they floss, they do all the things you're supposed to do, but they have a mouth that's been destroyed. It completely needs to be rebuilt. And it's like you start peeling the layers of the onion and you start going back. So now we're in a place where, sure, we can do the smile, but let's go back and figure out how we got here, because the teeth that God gave you are stronger than anything I can put in your mouth. And if we don't fix the root cause, then the reality is you're always going to be prone to going back there.
And the root cause may be what? Alignment, teeth alignment,
There's a lot to it,
maxilla.
like you already know, but I think there's some like pain aspect, some airway aspects. If your airway is compromised, then your body is compensating, and you're putting a lot more wear and tear in those teeth and that potentially porcelain or whatnot. And so the root cause, I think, has to do with some misalignment, that chronic low-grade trauma of pain, and maybe some airway disturbances that are happening when you're asleep, and maybe even some compensations when you're awake.
You define the airway.
It's basically, it starts either in the nose, ideally, but a lot of people have compensated because their noses have had some issues, so they're mouth bleeding. So that's problem number one.
Okay, so nasal congestion, nasal blockage somewhere, or deviated septum, something like that, right?
Yeah. And then the compensation with the mouth doesn't like to be dried out, which happens with constant mouth breathing, which creates inflammation and all the cascade of effects that can happen from that. So basically, air around you all the way to your lungs, and that's how. That is our airway, and it goes from the nose, the mouth, all the way to the back of our throat, and that to our lungs.
Yeah, I was learned from a physical therapist that um a lot of us are constantly air hunger or air restricted, and we don't know it. And that could be labeled as mental health issues, anxiety, mania, bipolar. It could be labeled neurological disorders, sometimes even tics as well. And it has to do with the body's mechanics. And she said that a lot of people are so tight up here in the head and neck, all right, that it's restricting the movement of the diaphragm. If the diaphragm can't go down, the amount of air that you get into the bottom part of your lungs is not as robust. And therefore, there's entrapment. No, this is years ago, but since then, someone walks into my office and I can tell. And I would say it's about 50% of the patient.
I've seen you do it, but
Yeah.
can you expand a little bit about that word entrapment? What does that mean, and what do you mean by?
That's my word. And this is the way I see it, right? So right now we're at the mercy of technology, and we have this concept of tech neck. Tech neck is you're on your phone, you're like this, and then you have this always this flexion, and then your body has to deal with the added weight because the angulation of the head goes forward, and your spine has to deal with it. So if your bones are off, then your fascia takes over. Fascia is the connective tissue. So you've pulled this way, your fascia in the back tightens up and restricts posteriorly. You stretch. So so entrapment means that because your fascia, your connective tissue is tight, there's not much room for your ribs to expand whenever you're taking a breath. So that's what I mean by entrapment. So you have that's one restriction. The second entrapment is that your jaw and head and neck areas are also creating this restricted space as well. And so people tend to be not just mouth breathers at night, but breath holders during the day. And people will like hold their breath and not realize they're holding their breath, right? And one of the ways I actually tell is I can look at someone's CGM, which is a continuous glucose monitor, which I have on myself right now. I can guarantee you too as well. Yeah. And I can guarantee you by the end of this discussion and podcast, my sugar will start rising because I haven't breathed appropriately. And what happens is that if there's entrapment in this space that's right here, our body releases cortisol, and cortisol is a stress hormone that releases glycogen, which turns to glucose from the liver into the bloodstream, and your sugars tend to go high without eating. Without eating. And that's a natural thing that happens when we don't necessarily take a deep breath, right? And so, interestingly enough, I see that with some patients, and then we have breathwork sessions here behind us at Texas Center for Lifestyle Medicine, and whenever they do breathwork, you see their blood sugars just come right down with breathing. And this is diaphragmatic breathing, and box breathing, and different metrics, different methodologies of breathing, right?
Yeah.
So my term for entrapment is literally the body being so trapped that we can't breathe. That's entrapment. Probably the better term is suffocation. That might be a little extreme, you know. But
Intermittent suffocation.
yeah. So I think that like the body's mechanics is also dependent on the teeth. And I learned from another dentist, Dr. Felix Liao, that whenever like the elderly they have dentures, um, when the dentures are in, their ability to function is actually better. But then they're told to take the dentures out by most dentists at nighttime, and then it actually impairs the body mechanics. They have more constriction and entrapment.
Because things are closed down. And they're not being held at the normal position.
You know, it's obvious to you, but it's not obvious to me, right? So there's no teeth like bracing it, and there's this term called vertical height, which you're losing the vertical height between your jaw, between your top jaw and your bottom jaw, because there's no teeth support in between, and that creates issues. So Dr. Liao was like, perhaps you should be telling people to leave their dentures in the evening time. But it's an extreme case of saying that like our jaw are so fundamental to our body's mechanics, it creates the suffocation or the entrapment that occurs when the jaw is off, creates a lot of different things that happen to the body. So cortisol going up, melatonin going down, so you have a hard time sleeping. And then daytime, you're sleepy because your nighttime sleep isn't that good. It creates sleep disorder breathing and sleep apnea, hormonal dysregulation. And I have a firm belief that a huge part of low testosterone in men and early menopause and menopausal symptoms in women actually has to do with airway restriction as well. That's my firm belief now, after looking at some data. And it contributes to infertility. And I can't tell you how many times in my practice we get our patients are treated for airway and issues with the teeth that pretty shortly they they have pregnancy, they get pregnant, and it's a really really common thing to occur over the last I think 7 years. I've been kind of aware of the airway connection, right? And so for me, this idea that your jaw fitting together is important is it's definitely a newer concept to me. But we're starting to see that. There's Netflix documentaries now on that, right? There's different talk shows. There's Jaw Hacks, the podcast, of all sorts of different things coming out. How our facial structures, our teeth, are like very important to our survivability and longevity and total body balance. And it shocks me. It shocks me because people are really suffering out there. And I know we've gone beyond pain, but people are suffering out there. And in medicine, we don't necessarily have anything to answer for these disease states and disorders, traditionally speaking, right? So if I go to a group of my doctor friends and I say, hey, I have this patient with fibromyalgia. So you're either gonna go, oh, I'm sorry, you're dealing with that, or it's like, oh my gosh, yeah, it could be quite difficult and kind of rolling your eyes. So that's sort of a natural thing to happen in the dots population. Not because we don't love our patients, because we deep inside in our heart don't necessarily know we have an answer for all this, right?
Yeah.
But that could be tied to the jaw and the airway, which I often find that it is, right? Or we have this patient with restless leg syndrome or periodic limitations of sleep. Other than fixing the iron for them, you can't really do much of anything else from a medical point of view, right? And so there's a whole sleep disorder side that we really have to like take control of. And if we don't take control of the actual sleep, it becomes an issue. But it always goes back to the teeth. It always goes back to the not just the alignment of the teeth, but the construction, the constitution of the TMJ, right here, right? The temporomandibular chain. And it's becoming more apparent for me that, like, in order for us to practice medicine, we have to collaborate with dentists. There's no ways. I hope it goes both ways.
Yes, it absolutely does.
Yeah.
Because again, some
Yeah.
of these things are beyond the scope of dentistry, and we can fix the oral contributions, but those go very far, but there's a limit. And at some point, someone like you, as an integrative and functional medicine doctor, says, hey, I can help you with the rest of the stuff to
Yeah.
really get this person back to being whole and truly healed,
Yeah.
instead of just putting band-aids on things, which is unfortunately happens a lot in Western medicine. That's right.
It does. And although I'm trained in functional medicine, I don't use a lot of it and whenever I work with the dentist because I don't have to. you do just traditional medicine techniques. When the body's mechanics is aligned, your spine is aligned, you don't have to go down a lot of the functional medicine route, to be honest, right?
Which is where.
Uh, and it's you're right. It's not just dentistry. It's not just medicine. Like body workers, chiropractors, craniosacral therapists. I love craniosacral therapy, myofunctional therapists. These are people working on the other mechanics of the body to decrease the suffocation phenomenon, decrease the entrapment that we actually have. That's right there, right? And guess what happens in lab work? Me, the MD, and we're like, well, okay, you have a lot of, uh, lab work that shows a lot of inflammation. Apolipoprotein B is high, HCRP, interleukin 6, TNF alpha, the list goes on. And people can have the perfect diets. They can have a great exercise regimen. But if they're clenching, right, or some people grind, TMJ issues, and they have pain or discomfort in different areas, headaches, migraines, then the only really resolution is looking at the oral contribution to all this as a first step.
Awesome. And I was actually just going to ask you that. So if someone is listening and go, I find myself in a lot of these things. And like you said, it's a very complex, intertwined situation slash problem. Where do you get started? Right? Because you can start in many different places
Yeah.
and it can be overwhelming. And depending on the practice you end up in, they might be very good at collaborating with other specialties, or they might be just kind of on an island alone. And then the patient takes the brunt of trying to bring everyone together to help them out. But that's very overwhelming for the average patient. For most patients, not even just the average patient.
We call that normal in Western medicine. A lot of times people have to kind of fight for themselves, and I get it, right? The question is where you start. I think where you have to start is working with someone like you, but then someone like you doesn't really exist everywhere either, right? Understanding the oral contribution to pain, the airway contribution to suffering, right? Um, from a dental perspective, from a medical perspective, yeah, if your doctors are going to be doing great, doing things that they know how to do, right? Whether it's prescription pain meds or interventional techniques, steroid injections, interventional pain docs can do other modalities and other injections in different areas. These are all kind of band-aids for chronic pain. Even the Botox, that's the botulinum toxin that's injected for chronic TMJ, migraines, headaches, those are also like temporary, right? And so, you know,
Question about that.
about Botox,
Botox. So
yeah,
I know it's widely used for patients who can't seem to stop clenching,
yeah,
which kind of exacerbates things like TMJ issues,
yeah,
pain, migraines because of all that hypercontraction in the muscles.
yes,
One thing I've wondered about, because I know you have a lot of data,
yes,
is when these patients get the Botox, their symptoms get better in terms of the muscle soreness and the migraines, but
not always, not always.
a lot of times, how do their airway and sleep study patterns look like? Because that muscle contraction is a compensation for more than likely an eating disturbance.
Good point. So, let's say this pain is the body trying to tell you something. It's like knock, knock. Hey, hey, hey. Knock, knock. And then if you do something to alleviate the pain, then it can't knock anymore and the house may burn down, right? So I call it the spidey sense. Pain is the spidey sense of the body. So um I think that there's definitely a place for botulinum toxin for injections. I think there's a place for other type of injections as well, but we still have to look at the root causes going on. Your point of airway is one that I've thought about for quite some time. Hey, what happens when you take away the compensation mechanism? For example, if your jaw relaxes, then it can't set your airway open at nighttime. Do your apneas get worse? Or does if you can't grind anymore, if you can't clench anymore, yes, it feels better here, but at what price? I had a chat with two sleep neurologists, all right, about this very topic, and they had two very different points of view.
Interesting.
and I have a third point of view. So one one sleep neurologist was like, well, that can actually botulinum injections can potentially compromise some parts of the airway, and then your breathing, your entrapment here gets worse, right? Which I see. Well, the other neurologist is like, well, that's true, but then you do alleviate some pain and suffering, but because you have less pain, you get the deeper sleep at night. Oh, okay. Also true. All right. I have a third view. My third view is that it's both. Is you can potentially get better quality sleep because of less pain. And you can potentially impair some of your airway. But it's all about what happens when you wake up the next morning. Like if you get injections and then the next morning you feel a ray of sunshine, then awesome. It's for you, right? But the next morning, if you have less pain, but your brain fog is worse, well, it's telling you something. That's just a body using another mechanism to tell you something. Oftentimes, it's the spouse that knows. Because when you wake up in the morning and you're in a grumpy mood, the person sleeping next to you knows more than you do. And so a lot of time is the need that I see. So I think there's a place for botulinum injections, but like you can't ignore the fact that you have to work with dental professionals to figure out if there's an oral contribution to pain, right?
Yeah.
And this is what I discovered. I worked with a lot of dentists over the last couple of years, and everyone just slightly different or vastly different in some cases.
Yeah, dentistry is not exactly standardized, which kind of keeps it interesting, but at the same time,
Yeah,
I think medicine is a lot more standardized
I think
because of
so.
your training,
Yeah,
the way
yeah,
it's structured.
yeah. Well, because all dentists are artists. Like you have to have intuition and art and creation of this, which I get. And so, medicine is quite different. A lot of it's structured, a lot of it's guideline based, right? So, and so the every dentist has the mindset of an artist and engineer, right? And I started noticing that the artist can create things, and if the dentist is wanting to create something that's beautiful and healthy smiles, great, that's awesome. That's the dentist artistry. But then the dentist like yourself is like, okay, well, great, beautiful smiles, I got that, right? I got the beautiful smiles, but what about body function? Not all dentists want to go there. In fact, most probably don't. But then someone like you, like, yeah, I'm taking it there, right?
Yeah, I just, like I said, I'm going to repeat that. I struggled with that because how did this person get here? And what about the person attached to those teeth?
Yeah, the person attached to yeah, your teeth, body aren't two separate things, right?
No departmental lines, like you say, right?
No, no, no. So, and I see this in my family, and now, my kids, my sister, well, especially my sister, she's using the STA appliance or Start Thriving Appliance, right? With Dr. Felix Liao. And my sister, right now, she's an interventional radiology resident. Like her function is better. Her thought process is better with the appliance in, okay? And it's weird. You know why? Because her improvement happened in the first hour,
Yeah.
not the first day, right?
I, yeah.
It's that is strange to me. And then her significant other, her boyfriend, uh, was next to her, who's also a physician. And he's like, if I didn't see it, like really would not believe that this is the case. So she actually had better range of motion in her neck and shoulders, which is really weird by just putting appliance. She's stiff. She's a stiff person like this, right? But then when that's it, it's like a lot more relaxed. I can see her getting better. Uh, the following week, she was in New York. The following week, she was she was walking to the hospital. She's like, there's a big difference because she didn't have her appointment. Because she left it at her boyfriend's and she's like, there's actually a pretty big difference, like a functional difference. Your need is different, like your attention is different, your body's mechanically different. It's a huge deal for her. So she really enjoys utilizing the appliance. Now, the STA is totally different than other things that I've seen because other appliances that are used are specifically used for like whether it's sleep apnea or sleep disorder breathing, upper airway resistance. This one is also improving the oral contributions to sleep apnea and sleep disorder breathing. But this one it has a primary benefit of improving functionality. So this one actually has an instant benefit that I've seen. And now that we have a lot of our patients that are getting this, and they're seeing instant benefit, it's not the first hour at least, at the very most, the first morning afterwards, right?
which is fascinating.
It's fascinating, and it boggles my mind, and it kind of pisses me off that I didn't know about it earlier. Yeah. But
We all feel that way.
yeah, and so now we're like, okay, we're kind of in this field of pain and suffering, which all doctors deal with patients who are pain and suffering. And staying in my family, it's a big deal. And then my younger daughters have, they started appliances much earlier on. They had different appliances, and seeing them with appliances, although my younger daughters don't have any necessarily medical issues, their behavior is different. It's easier to wake them up in the morning.
Because cake and no problem.
Yeah, because they have some impaired airway, but they're sleeping better, right? But then it's also easier for them to get off of screen time. They don't have the addictive potential of screen time that they used to anymore. I mean, they still like it, but that addictive potential is not there. Mood is better, so it's like it's really affecting the way our whole family dynamics as well. And so, had I known this before, a lot of things probably would be different. Yeah, even for me, I have severe sleep apnea, diagnosed really early on, and like I don't have the appliance right now. I'm in the process of getting one, but even with my CPAP at times, it doesn't necessarily do the job it's supposed to. I still have a lot of air.
Considered the gold standard.
Well, it's the gold standard in disease management.
Yeah.
It's is not considered gold standard disease curing. So there's different surgeries and jaw surgeries that have a curative effect or sleep apnea for some people, depending on the situation, and that's great, right? But a lot of people don't have sleep apnea; they have sleep disorder breathing, and they have clenching, and it causes a lot of pain. So what I'm noticing that is that a lot of our newer patients who have these appliances, they are better from head to toe, like literally head to toe. And it happens fast. And it really happens on day one. And when the appliance is out, they kind of revert back. They're like, okay, no, this is actually doing some good. So there's a really good positive reinforcement for that. And it's because when the appliance in, the body is more relaxed, the fascia is more relaxed. There's not a lot of air entrapment in the body like I was talking about before. And then we're starting to see their labs get better. Their cholesterol biomarkers are getting better after the appliance therapy, which also shocks me. You never think about like cholesterol affecting the way that your teeth alignment affecting your cholesterol and airway affecting your cholesterol. But that's what we actually see. So the inflammatory particles are getting better, LDL particle size is getting better, lipoprotein little a, LP little a is getting better, right? Um,
And
and the HSCRP. Like these are things that are like what a lot of doctors are trying to do, like diet modifications, et cetera, right? But man, I will tell you, like the airway improvements and jaw improvements with appliance, that does way better than anything that we can do pharmacologically or with supplements, including omega 3s, bergamot, red yeast rice, et cetera, et cetera. The list goes on, right? Because I've tried it all, man. I've tried it all. That's what I was saying earlier, that a lot of times when you work with dental professionals for alignment, we don't have to use a lot of the holistic integrative health strategies, naturopathic strategies, is because the body gets what it needs, which is breath. It gets alignment, and things become better, and then naturally improve from there. But here's my struggle: insurance doesn't cover these appliances; they're too new. Uh, So they can get a little expensive, which we recognize that, right? And the ones that insurance do cover, don't necessarily get the job,
And that's a problem.
right? And sometimes they can make things worse is the problem. And my original doc, because I had when James Nestor wrote his book Breath,
Yeah.
uh, yeah, I rushed to get my homie block, which is another sleep apnea appliance, but uh that messed me up. That really messed me up.
Interesting.
And the fact, well, I wish I brought it with me, but if I put it in, I might all like that when I write down. And so that really messed me up, and I didn't like it, and it just made me angry. Woke up angry, which means my sleep was actually worse. And I was using that and the CPAP at the same time,
Interesting.
but it was actually creating pain. And then there was another appliance I tried. I forgot the name of it. With an anterior bite similar to STA, that messed me. So I gave up on that for a couple of years. But then the STA is something I see that is like designed for the function of the body. So that's Liao, and he fit me for the appliance, which I don't have it yet. About to get it. And then he put this gel. What's the gel? I don't know.
Like we call it bite registration. It kind of holds your teeth in a specific position.
Yeah.
How your jaws come together.
The blue gel thing.
Yeah.
I call it the bubble gum because it looks like bubble gum. And he put that in my clothes, and as it hardened, right? I was like, all right, it's doing things. I can't tell. Not like my sister. My sister had a huge improvement even with that. And then, and then, and then he's like, hey, hold on your arms. I'm holding on my arm, and he's like putting a resistance against me.
I was just gonna talk about it because he did the same thing for me, and
This is interesting because I didn't know what he was doing. So he's like, hold on your arm. I had the appliance on. He's like, couldn't, and then he couldn't put it down, right? And I was like, all right, take the thing out. I took it out, and he's like, I was like, oh man, and I have a history of frozen shoulder from football. And then, and then I put the bubblegum construction bike back in. And then I'm like, oh my god, huge range of motion, and
and more strength too.
way more strain. Uh, so I was like, hey, can I go running with this? And man, my running is, and I was training. Well, I'm still training for my half marathon, but I killed my split time, my average split time for the month. I killed my split time for running, and when I came back, like usually my right Achilles heel kills me. If I go more than about 9 miles, and I went 10, and I came back, my Achilles is fine. I'm like, what's going on here, right? And so from a functional perspective, that thing is a beast, and it's different than other appliances I've tried before, only because the other ones really create a lot of discomfort and worsening entrapment, I think, really for me, right? So, um, and just so people know, I have no commercial interest in this appliance. This is really a testimonial from a patient, and I don't get any kickbacks or anything from this, but it's really my true testimonial from a physician, all right, and observing what's happening with my other family members who are also physicians, right? And they're like, whoa, what's going on here? And their amazement at things that we were never really taught in medical school or residency, right? And so it becomes sort of this wow factor really for me. And now I'm starting to see patients get fit with it. It's a wow factor for the patients, especially my chronic pain patients, especially fibromyalgia, and peripheral neuropathy, believe it or not. And literally peripheral neuropathy in the feet, we're seeing people get turned around really, really quickly, right? And one of them is my medical assistant. I can talk about him because he already had himself on video for another testimonial, and I've worked with my medical assistant for 12 years, and I've never seen something turn around so quick.
And he's a skeptic too.
He's the biggest skeptic in the world. He calls BS on everything by default. He's one of those guys. He's a tough army that you're guilty till you're proven innocent sort of person. And then he was kind of speechless after a while. He's never speechless. But
He's seen it all in neuropractice.
he's
He
seen it
does
all in
all
my
kinds of
yeah.
things.
He's seen every functional medicine person practice, every chronic pain, every worst case, and he had multiple surgeries himself. He actually did have the worst kind of entrapment called thoracic outlet, and that is the worst type where you're completely restricted. And so it's so for him to have that initial testimonial, like within the first 2 minutes of putting the appliance in EP, like that's really interesting.
I was there and I remember his eyes kind of welled up a little bit. You
That
could see it in his eyes and
yeah,
you could
wait,
just see like the disbelief, but he's like, his mind was feeling things that he didn't anticipate to feel.
yeah,
And he was just kind of like in relief, but disbelief in a way.
yeah,
It was very fascinating to see.
yeah. And so and for me as a physician and my faculty, and he's been my friend for years, and I unleashed every tool on this guy. And my mother is an acupuncturist, and so we have the entire holistic community at his disposal. And then 2 minutes after construction, not even the plans, but construction by fitment, he's like,
which is
"Whoa,
which is just like the trailer for the whole thing.
man!" My thinking is this, right? My thinking is this: when looking retrospectively at what I learned in medicine, it actually all does make sense. Uh, in neurology, we learned about something called the motor homunculus, the sensory homunculus. This is a term where we look at the motor and sensory areas of the brain relating to different areas. There's more brain geographically dedicated to your mouth and jaw than like your thighs, your buttocks, which is the largest muscle group in your body.
Yeah.
Significantly more. And we just thought, oh, well, that's the way it is. Okay. And looking back, I'm like, oh, there's a reason for that. Like our mouth and our jaw um, have a huge implication to human survival, mammalian survival.
Yeah.
I went back and nerded out. We have the beauty of using AI these days to search clinical trials. Uh, and I was on my perplexity.ai. I was like, hey, like find me some articles about this and the jaw contributes to neurological ingredients. Guess what? Most of the studies were done in veterinary medicine. The vets know about this. The dog doctors, people used to, well, they still do actually, shave down the dog's canines and take them out so they wouldn't, when they bite, they wouldn't, cause any harm. The dogs were nuts. It's almost like the dogs went feral because of it, because they can't regulate their autonomic nervous system. The dogs develop something called sympathetic dysautonomia, and a lot of humans have that too. And then so that was 80s, 1980s.
And dogs don't have placebo. So
Yeah. And then it wasn't until 2000, I think 2011 or 2012, came across oral maxillofacial surgery studies at NYU looking at facial fractures. That's how so many people with maxillary fractures along certain, especially the the forefront teeth, I guess the incisors, and just lateral to that. If there's any interruption or fracture in there, these patients develop what they call PTSD at the time. It wasn't PTSD. It was actually parasympathetic dysautonomia, similar to what the dogs have, right? But it's slightly different. So they discovered this thing called the TCR, the trigeminal cardiac reflex, where the maxillary branches of the trigeminal nerve, which are the nerves that go to your maxilla, your face, goes back to the brain that sense it says there's something dangerous going on here. So manipulation of the teeth with the dogs is telling the dog's brain that there's something dangerous going on here. Well, as it turns out, it happens in humans as well. So the TCR, the trigeminal cardiac reflex, is our crunchy white firefly center. And if that neurological input is disrupted, this is where we're seeing a lot of these mental health things come up, right? Especially with like PTSD and anxiety and stuff like that. And so that obviously bugged me once again. And I started to understand another concept, which is sleep medicine, is that a lot of disruptions we actually see in sleep, like why do some people have deep sleep and REM and some people don't, right? Even if their airways fine, they don't have sleep apnea, like why the transition? It actually has to do with their jaw structure, whether or not they can activate this part of the brain that controls the vagus nerve. The vagus nerve creates this calming balance, right? So literally, our jaws control our vagus nerve. Our jaws, our teeth alignment control the vagus nerve. Not just our jaws, but our sinuses also does as well. So the same nerve that goes to the maxilla also goes to the sinus. It's called the sinus branch of the trigeminal nerve. It goes to the same nerve root. And so the entire way that we breathe tells our brain whether or not we're in survival mode or in calm mode. Which is why when you take deep breaths and meditative exercises, right, diaphragmatic breathing, your brain calms down. It's the same feedback mechanism. It goes both ways, right? And so, I wish the field of psychiatry knew and understand this, and some aspects do. But this also explains why in healing modalities, especially the studies done in Asia, Tai Chi, Qigong, and breathwork practices have a huge outcome for the brain. In 2024, you know what they found?
What?
These breathing exercises increases the size of the brain in the elderly, can decrease progression to dementia anywhere from 21% to 41% in people
That's
for
huge.
with Tai Chi, which is breath and body movements, right? And so now that I know that, I mean, it's not surprising, but like the lesson here is this, right? Well, first I have to read more veterinary studies. That's the first lesson.
It's fascinating.
The second lesson is that we have to look at things within the context of everything else. So much so, you have journals that's published in oral maxillofacial surgery. They're just looking here. You have journals published in Asia on longevity and Tai Chi. You have journal X, Y, and Z, right? I think with the beauty of AI, the AI actually finds peer-reviewed publications for me now where it's related to the answer I'm trying to have, and the AI is not biased. So that really helps my brain out, right? But I'm board certified in internal medicine, so I'm reading JAMA and the Journal of American Medical Association and stuff like that. But that's really narrow-sighted. Like, but I've learned so much from these veterinary studies and applying it to human studies across different specialties. And it honestly, all really comes back to here. The jaw, the teeth, the airway, the sinuses is all right here.
I was thinking about something as you were talking to kind of bring it full leap. Say, when you were saying that pain is a message, or like your body is sending you a message, and part of that message is something is off, and your body goes into survival mode.
Yeah.
And from an evolutionary perspective, if you're in survival mode, your production is not a priority. And so what you're talking about with these
No, that's true.
things, what has happened with fertility, if your body is in survival mode, the production goes down the line, healing your body. And it's like, because your body can't tell the difference between you just kind of half joking in your sleep or a tiger in the jungle. So it goes, forget all of that. Let's keep you alive. Forget reproduction. Forget fixing myself. And then what can happen is now you're living with pain. Cancer risk goes up because your body can't do housekeeping and things like that.
Yeah.
So it just kind of comes together to this thing with like when your body is in survival mode, the other things that you want it to do is just not able to do, or it just doesn't prioritize.
Yeah, this reminds me of something. So one of my good friends, a cardiologist, his name's Dr. Imran Dar. Shout out to Imran. Amazing guy. Interventional cardiology. His wife is a dentist. And I'm like, hey, y'all have like the perfect marriage of medicine, is because in cardiology, we know that a huge amount of coronary artery disease, valvular heart disease, and even some arrhythmias are contributed to dental disorders and periodontal disease, right? And so this is nothing new. I mean, I learned that in med school earlier on, right? But But now we're seeing over the last couple of years these huge amount of data of the same dental disorders relating to Alzheimer's disease, especially with developing Alzheimer's plaques. And now we know it's not just periodontal disease, dental disease, sinus disease. It all kind of tracks the same way, right? And so, brain health is skull health. And skull includes teeth, right?
Yes.
And skull health translates into total body health. And I think that's the biggest lesson that I really learned in my career is to, hey, what do you really want to focus on? And so when someone's coming in and have, this pain, that pain, this disorder, this chronic illness, autoimmune disease, et cetera, I'm watching them talk, seeing how they're holding their body, and I'm actually looking at their teeth too. So I become really observant in sort of a top-down approach, right? And then they're always surprised when I told them to stand up and have them walk, right? So that observation, though, gives us so much feedback on what the oral facial structure is doing.
So I will say I was there. We can say this. My wife is your patient, and you were my friend before she ever became your patient. And I came with her to the appointment not because I had to, but because I was intrigued and curious. And she's seen a laundry list of specialists through the years. And she comes to you, and about 45 minutes into her appointment, you bring this like bite stick and go, get up and walk. Right? And she walks a tongue depressor.
Yeah,
And
yeah,
then you go open your mouth, and she's just looking at you, looking at me like, what is happening?
yeah,
No medical doctor has even seen her teeth. They have no idea.
yeah, yeah,
And you kind of did the simulated position.
yeah,
Um, and she started walking straighter.
yeah,
Her hip pain improved.
yeah.
And like she was just in such disbelief, but I got to give you credit because most medical doctors don't even look in the mouth like, not my problem, not my situation, but it's all so tied together.
Yeah. I just learned that from Dr. Felix Liao before I met your wife, and so I'll give him credit. But it's like as an MD, I have two choices: prescribe you something, or can I look at the root cause in a very short 2 minute, and they get you on the path, right? And we always have that choice, and the perception is always, well, let's do the patient a favor and create comfort, which is great. There's nothing wrong with it, right? Uh, but empowering a patient is really different than comforting a patient. And I think in medicine, we're in the business of empowering. At least I am. I
Yeah.
don't know about all docs, right? We're in the business of empowering. And so the practicing medicine is practicing every day to challenge our limiting beliefs of the things that we learn based on observation and based on inclusivity of other people and other professionals, right? If I wasn't inclusive, then I never would have talked to Dr. Felix Liao, who actually he's the inventor of the STA, the Start Thriving Appliance. Never would have even talked to him, you know?